Orlando. Thanks for watching. Let's talk about synthetic cannabinoids. It's not one drug, but it's hundreds of different chemicals that are unrelated to one another. They're synthesized and they're manufactured in a laboratory. They have nothing to do with marijuana. They have no cannabis, no THC. These are chemicals that are manufactured in a laboratory. They're sprayed onto dried plants. The dried plants are ground up. Then it's sold as synthetic cannabinoids, or they're sold as liquids to be added to vaping pens. They're marketed as alternatives to marijuana. Sometimes they're mislabeled as marijuana. They're sold as safe and legal and natural and harmless. It's also been called fake weed or synthetic marijuana. But the only similarity these chemicals have to the cannabinoids, and the reason for the name synthetic cannabinoids, is that they were synthesized to act on the cannabinoid receptor in the brain and elsewhere. And there's large variation in the products. You don't even know if you're buying one batch and then you buy another if you're getting the same chemical. And two identical compounds sold in the same place, no guarantee that it's exactly the same. And the potency varies quite a bit. Remember, it's sprayed on dried plants. They're mixed up, but the mixing isn't always thorough, so you can get areas that are known as hot spots, where you have more of the active ingredient, and that leads to greater toxicity. They're designer drugs, and they fall through the cracks in the legal process. It's estimated that at the present time we know of at least 169 of the different chemicals, but there are more than 700 chemicals. The number and the chemical diversity and the speed of emergence of the chemicals leads to a situation where many of the products aren't specifically labeled as being illegal. It's even a challenge to identify what the chemical is, because of course there's no list on the product, no label, no hint regarding what the dose is, no hint regarding what the chemical is or what you took. And actually, these chemicals were never meant to be heated and inhaled in the first place. Their use can be dangerous, lead to many of the complications that we're now seeing associated with vaping-related illnesses and the increase in the number of life-threatening complications and deaths. Never been tested on humans, considered that the use is equivalent to Russian roulette. And worse yet, they're now being sold by dealers containing stimulants and hallucinogens and hypnotics and sedatives and ecstasy and heroin and cocaine, made to look and taste and smell like marijuana. But remember, you're inhaling a dried plant on which a chemical was sprayed, and it's the chemical that's the active ingredient. It's not like marijuana. Marijuana, THC, that's the active ingredient. The active ingredient happens to be natural. Now, the whole story began in 2005 in the Psych Deli in London. Gained popularity by 2006, and by 2008, investigators, forensic investigators in Austria and Germany found the JWH-18 that was sold under the name K2 or Spice. They found it, and it was associated with smoking mixtures or incense or room deodorizers. And by 2009, there were more than 20 countries that were using the substance. Chemicals were first developed by scientists who were trying to investigate how cannabis affected the body. At the time, they thought that they might be able to come up with a new discovery for either pain or cancer, or neurodegenerative diseases like multiple sclerosis or HIV or drug dependence. They were synthesized for cannabinoid research. Remember, at the time, it was illegal to use the cannabinoids. There was no cannabinoids. None of the marijuana was released to research institutions. Actually, it was these chemicals that were instrumental in discovering the CB receptor, the cannabinoid receptor in the brain, and the endocannabinoids that are actually made in the body to react with those receptors. Well, what are the names of the substances? Lots of different names. K2 and Spice and synthetic marijuana and legal weed, and sometimes they're called Black Mamba and Bombay Blue and Genie and Angry Birds and Yucatan and Kush and Scooby Snacks and Mr. Hazy and Joker and Mojo, all sorts of different names. They're smoked as cigarettes like marijuana, or increasingly they're added to vaping material, and they're smoked in e-cigarettes like the Juul devices, or they're added to herbal tea or in foods like edible gummies. First use in the United States occurred in 2008, 2009. Then by 2011, substances were the second most widely used drug in high school students and 17, 18-year-olds. More than 11% used them. The number declined through 2016 to about 6%. Lately, it seems that they're making a comeback, so it seems that maybe about 3 to 10% of high school students are using the substance, and increasingly older people using the substance too. And because of economics, see, marijuana is expensive, but the synthetic cannabinoids are not, so it's often added as an adulterant to marijuana, which means that a lot of people who are using what they think is marijuana are actually getting some or all of the synthetic cannabinoids. The reason people use them, obviously, is for the psychoactive effects, but also people are using them specifically because they don't show up on the standard tests that are performed. So that means people have a tendency to use them if they're in the military or if professional athletes or they're parolees or people who are in substance misuse clinics. Well, those people are routinely tested, but the synthetic cannabinoids don't show up on the routine tests. They're also appealing because of the low price. You can buy them in the paraphernalia or novelty shops. You can buy them in head shops or liquor stores or gas stations or convenience stores. You can buy them online as incense or herbal products, and you buy them from your drug dealer. Unfortunately, the drug dealer might be selling you marijuana, but it might also be contaminated with the synthetic cannabinoids. They're often labeled as natural and for a legal high. Sometimes they're added unknowingly to you in a cartridge for vaping, or air or room fresheners, or potpourri. They're not labeled with any specific ingredient. Sometimes the label on the product might say it's not for human consumption or don't burn this product. Sometimes it's said that it's FDA compliant and it's been tested. Some memorable issues was named Zombie in July of 2016 in an episode in Brooklyn where 33 people were intoxicated and 18 people were taken to the hospital. Bystanders referred to the people as kind of reminding them of zombies because they moved slowly, they had a blank stare, they occasionally groaned. Then between March and May of 2018, hundreds of people in the Midwest and in Maryland were unfortunately found to have some bleeding problems with the synthetic cannabinoids that were unfortunately contaminated with a rat poison, a relative of warfarin. It had been added to prolong the duration of the effect of the synthetic cannabinoids, or maybe it was added by the manufacturer in the fields, was spraying the fields, or maybe by the supplier as an accident, or maybe it was a malicious incident. Well, the federal government has banned some of the substances, and so too have some of the state and local governments. Many of the laws started off when a teen shot himself in 2010. He had smoked some of the K2. That led to the David Mitchell-Rosga Act of 2011, and then in 2012, President Obama signed the Synthetic Drug Abuse Prevention Act. 2011, the DEA made 5 of the products illegal. Then in 2012, 15 more became illegal. But it's a whack-a-mole situation because the manufacturers just keep coming up with new products. Lots of loopholes to work around. 2017, international headlines. The federal authorities indicted 2 Chinese nationals because they had large quantities of fentanyl analogs that they were producing in 2 plants in China. But what really happened was the fentanyl was just something they were also making. The manufacturing facilities were major producers of the synthetic cannabinoids. And when you buy the labeled synthetic cannabinoids, they're labeled as containing alfalfa or blue violet or nettle leaf or rose hips, but of course they don't contain any of them. They also contain substances that block or mask the chemical detection of the substances. So they contain some vitamin E acetate, tocopherol, or eugenol, or some of the fatty acids. They oftentimes come in packages that are brightly colored with cartoon characters or psychedelic images. And sometimes when you buy them from the dealer, they can contain the opioids like tramadol or some of the psychoactive alkaloids or kraton. Maybe sometimes they contain some of fatty acid derivatives like oleamide that acts similarly to cannabinoid. Maybe they contain some of the bath salts, the canthinones. There were originally 5 major categories of the synthetic cannabinoids. The classic cannabinoids that were somewhat related, at least chemically, to marijuana. And then the non-classic cannabinoids, and then a little bit further afield, the hybrid cannabinoids, and then there were 2 other groups, the amino alkyl indoles and the eicosanoids. The number of substances is just phenomenal. They keep changing. Now, most recently, they've added some fluorine to increase the potency. In 2019, in September, the Associated Press commissioned laboratory testing of 30 different CBD vape oils, and 10 of the 30 contained synthetic cannabinoids, and others had no CBD at all. And then we have the Green Machine. That's a pod that's compatible with the Juul e-cigarettes. 7 of them were tested. 4 of them contained the synthetic cannabinoids. And interestingly, the different synthetic cannabinoids were different in different areas of the country, depending on the flavor that you happened to buy. Even though the packaging was the same, the chemical was different whether you bought it in Florida or California or Maryland. Then the government did a study of 350 samples that they purchased in 9 different states of supposedly CBD. 128 of these 350 samples that were marketed as CBD contained the synthetic cannabinoids. And obviously there's a financial incentive that people have to add adulterants to the marijuana, because you could buy the synthetic cannabinoids for about $25 a pound, but a pound of CBD would cost you hundreds or thousands of dollars. As I mentioned, it's not a substance that we can identify through the standard marijuana tests. The standard marijuana tests only detect THC and its metabolites. And with these synthetic products, they don't have any THC. They don't have any of the marijuana in them. And then as a result, we can't find it. And additionally, you only need a small quantity of the synthetic cannabinoids, so it's difficult to find a small quantity of something. And they're highly metabolized in the body. So the window to detect them is relatively small, and none of the pure product gets out in the urine, so we can't even measure the urine. Now, there are some commercial kits available, but a kit only is developed to detect one of the substances. So we know of 169 different substances. It's impractical and cost ineffective. We can't use them on all. So for instance, on JWH-018, it's metabolized into 20 different metabolites. They go out in the urine. Well, the synthetic cannabinoids bind to the same receptors as CBD or the THC, the marijuana. The receptors are called CB1 receptor, CB2 receptor. But unlike the THC, that's a partial agonist, the synthetic cannabinoids are full agonists of the receptor. And not only do they work on the receptor, they have a prolonged effect on the receptor, and they have other physiologic functions as well. So the difference is kind of like putting your foot a little bit on the gas and putting the pedal to the floor. That's the difference between marijuana and the synthetic cannabinoids. Pregnancy, absolutely not to be used. Severe compromise of fertility and pregnancy outcome, at least in animal models, not studied in humans. The naming of the substances, that's kind of peculiar too. They're named after the scientists who first discovered the different chemicals, or the institutions or the companies where it was discovered. So JWH stands for John William Huffman, AM Alexander Macrianus, or HU, Hebrew University. And sometimes it's named after a popular event or a popular situation in society at the time. So AKB-48 is named after a popular Japanese girl band, or XLR-11. It's liquid fuel for aircraft. Sometimes they're named after the chemical that's in them, like Apica or Apanaca. And unfortunately, all of these products have a wide array of side effects that range from violent behavior and seizures and agitation and irritability and confusion and problems concentrating, extreme anxiety and lung problems, breathing problems, loss of consciousness, gastrointestinal problems, heart attacks and palpitations and hypertension and stroke and hallucinations and delusions and kidney problems and suicidal thoughts and psychoses and agitated delirium. People tear their clothes off, sweat profusely, the body temperature goes up, muscles break down, have flaccid paralysis, and then you can become addicted to the products. And if you're addicted to the products, then you can't stop, because if you've used them, then you have withdrawal symptoms. Then you also develop the headache and the nausea and the vomiting and the severe anxiety and the sweating and the insomnia and the depression and the irritability and the breathing problems and chest pain and seizures. Now, marijuana so far is not linked to any fatalities, the marijuana, but the synthetic cannabinoids are, and as a matter of fact, there was a threefold increase in the incidence of fatalities just between 2014 and 2015. Well, unfortunately, remember, we only know of 169 of the 700 suspected chemicals. And these things bind to the CB receptor, and they stay on the CB receptor, and they're about 100 times more potent than the cannabinoids, or THC. So if we were to look at THC and look at how it reacts with the cannabinoid receptor, the CB1 receptor, we find that in order to get halfway to the maximum effect, we would need 250 nanomoles of THC. But if we look at a synthetic cannabinoid, we would only need 5 nanomoles, not 250 nanomoles. And as a result, we find that there is an increased incidence of psychotic reactions, and when a person develops a psychotic reaction to the synthetic cannabinoids, unlike with THC that might last a couple days, well, with the synthetic cannabinoids, last several weeks to several months after you stop using the product. And if you had previously been diagnosed as having a psychotic disorder and been stabilized on therapy, well, this can throw everything off, and you can start having your psychotic reactions again, and even cause psychotic reactions in people who never had a history of psychoses. And possibly even worse, the natural CBD contains a chemical that seems to be a calming chemical or an antipsychotic chemical. Well, then, when we talked about the side effects, remember, there are side effects of all the additives too, like the situation that occurred with the bleeding from the nose and the gums and the blood and the urine and the blood in the bowels and the heavy menstruation because of the contamination. So we don't have to know just about the chemical, but we have to know about what the contaminants are. So interestingly, a study in Mississippi, they decided that they were going to have enhanced surveillance. And in 2015, for a 6-week period, they found 1,243 people visited the emergency room in the state because of use of synthetic cannabinoids. These people ranged in age between 12 and 69 years of age. 10% were admitted to the ICU and 10% were admitted to the hospital, to the non-ICU unit. And 17 deaths were potentially related to the synthetic cannabinoids. Now, compare that to the entire United States from January to May of that same year, when Mississippi accounted for 35% of all of the reactions to the synthetic cannabinoids. And what you see is that if you look, you're going to find. And for the rest of the country, we just don't really look. We don't think about that. One of the doctors, the emergency room doctor on the front lines, said it's horrible dealing with these individuals because they could come in with a heart attack or a stroke or a seizure or bleeding into the brain, and you don't know what the problem was. Was it a typical cause of a heart attack, or was it because of some chemical that they were using? Now, the raw product is manufactured in China or India. There's some evidence organized crime is now becoming involved in this. The dealers add the trade name and the catchy packaging, and they mix the flavors. They add the bath salts or the cathinone or the ecstasy or the methamphetamine or the PCP. They can even change the ingredients in the packages. So even though you might be buying one particular package at the vaping store, well, it doesn't necessarily have the same product in it the next time you go back. That's giving the marijuana industry, the medical marijuana industry, the CBD industry, a bad name. give them a hard time because they have to deal with these fake products. So that's the story of the synthetic cannabinoids. Remember, they're not plant grown, but rather they're made in a laboratory in China or in India, and then they're sprayed onto some plant, and then you go and buy the plant. And unfortunately, these products haven't been tested in humans. You have no idea what you're getting. The results oftentimes are disastrous, as is apparent from the vaping-related illnesses that we're now seeing an increasing number. And remember, we don't have the ability to detect these chemicals in your blood or in your urine. So we can't tell you what you've taken. So my advice is, stay away from these products. That would be the best thing to do at the present time. Anyway, thank you for watching. If you enjoyed the show, please tell a friend, maybe consider subscribing. Appreciate your interest. I'm Dr. Ken Landau.